This is Talk with Audrey. Since COVID-19 was declared a global health emergency, Facebook has been working closely with global and national health authorities to promote credible information to keep people safe and informed. My guest today is Kansen Jin, the head of health at Facebook, and we're going to talk about all that Facebook is doing to help keep people safe and informed about the coronavirus pandemic. Welcome.
Thank you for having me, Audrey.
Appreciate you for joining me. So, this is a worldwide issue. Facebook is a company with far-reaching tentacles into every single corner of the world and so many people. Tell us more about what you're doing at Facebook during this coronavirus pandemic.
Sure. So our top priority has been to enable people to get credible information from trusted sources, especially health authorities. So we've been working very closely with the WHO since January when they declared this a global emergency, as well as the CDC and other organizations to help here. We also realize that the effects are pretty wide-ranging, obviously. So people rely on Facebook, Instagram, Messenger, and WhatsApp to also stay connected with their friends and family. So we're working very hard to make sure that our services remain reliable given the increasing demands. And lastly, businesses are also quite affected, and the people who work for those businesses. And we are also taking steps to support them as well.
So, everybody, I think, pretty much counts on Facebook. I know I do. I look to it for information about my friends and my family. I also look for information on Facebook when it comes to the impact that this situation, the coronavirus, is having on perhaps friends and family worldwide. And then I hear about businesses. And then, of course, as you mentioned, you get information, and you're not always sure which information to trust. So how is, Facebook going to be able to ensure that there's accurate information being disseminated?
It's a really good question. So we've taken several steps. First, we've been working really closely with organizations like the WHO and CDC. We've given the WHO unlimited ad credits so that they can really reach people where they are on our platforms with the credible information. And we've also given similar ad credits and support to the CDC and other organizations worldwide. We're constantly looking to do better here. So yesterday we released the Coronavirus Information Center on the Facebook app, which is a central place to find the latest information about coronavirus, resources from health authorities around how you can help prevent its spread, as well as ways you can help support your community or get help.
Wonderful. And so there's a central place then that people can go on Facebook, because I understood, I saw a notice on Facebook that Mark Zuckerberg was, having like a live broadcast on Facebook Live about the coronavirus. So is it a central location? Where is this central location on Facebook, and how do people get to it for the information?
That's right. So if you open up your Facebook app and you just search for coronavirus or COVID-19, there should be a link to this information center at the top. Also, if you go to the top of your newsfeed, there should be a link there as well. And the interview that Mark did with Dr. Fauci yesterday was also featured in the information center.
Wonderful. Because oftentimes, again, people don't know what's what and who's who and what have you. So, even if I were to put this information on Facebook, they'd go, well, what does she know and how accurate is this? So it's good to know that there's absolutely one place that you can go to for accurate information. So now I understand that you also have family in China. Can you speak to us about your personal connection and how that's affected and impacted your approach to this?
Yeah, absolutely. So I was born in Wisconsin, but a lot of my extended family is still in China. And so when this first started hitting in China a few months ago, we were obviously quite concerned. Thankfully, they're all okay, and things are starting to get back to I hate to say completely normal, but starting to trend in that direction there. So that's been very reassuring to see. More close to home, my parents are older Americans, and they're in the more at-risk segment. So they have, following advice from authorities, self-isolated in the last week or a week and a half. And that's been a little bit hard, even though they're just down the street. We can't meet face to face. And so I've been putting an extra effort into making sure that I stay in touch with them through phone calls or video calls. And that's another way it's affecting me personally.
Yeah, I also have older parents, and keeping them safe is important. And this is a worldwide issue. And I think that, and you can just tell me if, again, Facebook is a huge company, but it's made up of people. And everyone has been impacted by this. There are also people who are taking advantage of the fact that people are impacted by this. So what is Facebook doing to prevent people from taking advantage of this current climate?
Yeah, no, it's a problem. In a lot of ways, our services mirror society, and you see the good and you see the bad, and we're trying to amplify the good and reduce some of the bad. One thing we've seen, and this isn't limited to Facebook, is people are sometimes hoarding masks or scamming people around some of these types of supplies, which frankly need to be conserved for first responders and healthcare workers. And so one of the steps we've taken is to ban the sale of masks on our platform. And we're working to step up enforcement here. But it's also, I think, worth knowing that there's just so much good also happening in the world. And I've been really inspired by some of the examples of people coming together to help each other through this as well.
How are you, or how is Facebook? Because I know you're in the health. There are also oftentimes a lot of comments that can be disconcerting. Some of them are deeply divisive, racial comments and what have you. How are you guys, or are you able to monitor those? Because I know it's hard to do, but
we've been stepping up our efforts on some of these things. So, for example, misinformation that could cause harm is an area where we've been stepping up our efforts to remove that content on Facebook. If the WHO or some of these other authorities give us information that a specific thing is both false and could cause harm to people, we do our best to take it down. So those are a few steps we're taking there.
Yeah, that's got to be a tough one when you're dealing with millions and millions and millions of people and billions of posts. I can only imagine the challenge there. I understand also that Facebook is working with local governments to get up-to-date information when it comes to closures and other specifics that might be important.
Yeah, that's right. So a lot of local and state governments are actually already using our products to get the right information out to their constituents. So, for example, I live in the Bay Area, and so I've been following updates from the San Mateo County Public Health Department as well as the California Department of Public Health. So there's a lot going on already, and we're doing our best to support that. Internationally, the government of Singapore actually has set up this helpline on WhatsApp where people could subscribe to get daily updates from them about the latest information. And we've heard from people there, including our own employees who are based in Singapore, that has been incredibly helpful. And according to the government, there is something like 10% of the entire population has signed up.
That's pretty incredible. So local governments are then using your information from Facebook to disseminate on their Facebook pages, their feeds, and perhaps live broadcasts to be sure that they're providing accurate information and to update citizens in their counties.
So, yeah, that's right. It's more of us making it easy for people to connect with their local governments and the information disseminated from the local governments to the people. So, for example, in the COVID Information Center, if you go there, we will have links to local government websites as well as their pages on Facebook and a feed of the latest posts from your local and state and national authorities.
Okay, wonderful, wonderful. So I know that there are people like, well, you're in San Francisco. I actually live in New York, but I'm in Vacaville, and Vacaville, California, which is a little town that I grew up in, and so we are on pretty much lockdown, as you are. But there are a lot of people who don't have family members around them. They're in their apartments or their homes alone. How can Facebook sort of help to ease that sense of isolation for them?
Yeah, no, I think it's a huge challenge. And I guess from a personal perspective, I've been putting extra effort into staying connected with my parents, both through Facebook products like Messenger and WhatsApp, as well as through the phone. And we're working really hard to make sure these services remain up and are reliable, given that we've been seeing such an increased need for them going forward.
Well, I know that there's one good thing. I hear more from my grandchildren every day. It's my kids are 4 and 2, and they're on daily video calls with their grandparents as well. Yeah, isn't that great? I mean, so there's, thank God, quite honestly, for social media and the opportunity to speak, face to face virtually with family members or friends, and even maybe to reach out to your neighbor if you know that they are alone and that they might perhaps need a word of encouragement instead of shouting over the fence.
Absolutely.
Yeah.
Yeah, we've been seeing that happen a lot too, through Facebook groups and obviously in other places. There's also been fundraisers to support people in the local community. There are a couple moms in Vermont who started a fundraiser to support janitorial staff at the local schools, basically people who are going to be disproportionately affected. And we're seeing a lot of that happen, and we're doing best to support that type of coming together on our platforms as well.
Well, that's wonderful. And it also, perhaps someone listening will have an idea about a way to help folks in their communities as well by making donations and using Facebook to do that. So, wow, this has been really informative. I know you've got a lot of other people because we're trying to get the word out about what Facebook is doing and to help people connect and understand and get real-time, real information, validated information. Kansen Jin, the head of health for Facebook, has been my guest. Thanks so much for joining me. Stay safe out there, and I'll give you my social distance hug and appreciation for you being on the show. And all of you out there, stay safe and, take heed. Follow the guidelines of your state, your city, your county, and, take time now to connect. Thanks so much, Kansen Jin, for joining me.
Thank you for having me.
My pleasure.